Hello, everyone. Welcome to our Friday media briefing. Happy you could join us today. We have topics today about contact tracing and an upcoming virtual town hall on personal services. I am looking at our list and I see Kristi Markey from our public health department is on the call. And we'll go ahead and start with her. And she's going to tell us a little bit more about the process of contact tracing and, of course, why it's so important. Good afternoon, Kristi.
Good afternoon. Thank you for inviting me today. I wanted to start by giving a little bit of overview of contact investigations. Although they might be a new concept to most people, they are very much a part of public health and have been around for quite a while. Case and contact investigations are fundamental public health activities that are focused on containing the spread of disease. They're core public health core disease control measures that have been employed by public health agencies for decades. They occur daily in Monterey County Health Department to control the spread of more common diseases like STDs, E. coli, whooping cough, and tuberculosis. And when we do contact investigations for STDs, we call them partner services. So there's a lot of different names for the same type of function, but the focus on each of these is to break the chain of transmission of disease. So successful case and contact investigations depend on a well-trained public health workforce. So the staff conducting contact investigations in Monterey County come from a variety of different backgrounds. Some are registered nurses, public health nurses, licensed vocational nurses, epidemiologists, health educators, physical and occupational therapists, disease investigation specialists, and community service aides. These staff have expertise in infection control, worker safety, health education, and an extensive knowledge of the local community resources that our clients may need to access. So really the process of contact and investigation starts with notifying individuals that they may have been exposed to a disease. The contact investigators reach out to the person, they provide health education, they gather information by asking a predetermined set of questions, they're responsible for monitoring their health, and linking people to testing services when it's appropriate. And the contact investigators will also provide instruction on how to self-quarantine. That means keeping themselves away from others during their potentially infectious period. In Monterey County, there are about 8 close contacts for every 1 case of COVID-19. However, with some case investigations, we've had as many as over 50 contacts identified from a single COVID-19 case. And this keeps our contact investigators very busy. Also emphasizes the importance of social distancing during our local epidemic. Right now, the Monterey County Health Department has 45 trained COVID-19 case and contact investigators. Our teams have identified over 2,700 contacts to date and have successfully engaged over 98% of the contacts that we've elicited. We have a very successful program here and we're very proud of it. We have, since the beginning of the epidemic, been doing extensive case and contact investigations for each case, which is a little bit different than what's happened in other areas of California and across the nation. So we are expanding our teams, but we, in terms of ramping up, don't need to ramp up because we've already been ramped up. You may be curious about what happens when a contact investigator calls a person. The first thing that the contact investigator is going to do is identify themselves. Someone who calls you from the Monterey County Health Department will always provide their name and they will always state that they work for the County Health Department. The next thing they would do is verify that they're talking to the right person. That means they may have to ask a few basic questions, so it's going to include verifying your name, your address, or your date of birth. We do keep that information very confidential. We want to make sure that we're talking to the right person before we start sharing information. The next thing the contact investigator would do would be to tell the person they have been exposed to somebody diagnosed with COVID-19. However, the contact investigator isn't going to tell you who that person was, even if you may already know, or even if you ask. That's, again, part of our protocols to keep everybody's information as safe and confidential as we can. The contact investigator is going to ask about your health, about whether you have any signs or symptoms, if you've been recently tested, if you have, what's happening in your home situation, can you keep yourself away from others? They're also going to provide instructions about how long the person needs to self-quarantine and what the process will be for checking in with them. Sometimes it can be by phone, by email, or text. We try to do whatever the client prefers and whatever works best for them. This is a client-centered process. What a contact investigator will never do is ask about bank account numbers, credit card numbers, social security numbers. They will not ask about citizenship status or share information about citizenship status if the client voluntarily tells us that. We don't ask for passwords to your computers or to your email accounts. And if anyone asks you for this type of information, hang up because they're not calling from the health department. Also, most of the time we contact people by telephone. So this can kind of help you determine whether or not the health department is really calling you. Sometimes we only have an email address for a person, and then we would send an email to just introduce ourselves and ask for a phone number to contact them so we can have a conversation. If you ever have any questions about whether a person works for the health department or not when they're calling you, you can always ask the person for their name and then call the COVID-19 hotline at the health department to verify that that person really works here. And that COVID hotline number is 831-755-4521. So don't be afraid to do that if you question whether the person really is calling from the health department. It's also really important that everybody answers the questions as completely and accurately as they can that the contact investigators pose. It's important to comply with the instructions. That's one of the reasons why that's one of the ways we can control COVID-19 in Monterey County. Unfortunately, we've seen a recent increase in cases locally in Monterey County, and without a vaccine to prevent the disease, case and contact investigations are one of the few tools we have to try to stop the spread of disease as we return to a more routine daily school and work situations. It's also really important that case and contact investigations don't replace the good public health measures that we all need to practice. We need to continue to practice good hand hygiene and social distancing. We need to wear face coverings to protect the people who are standing in front of us. And all of these measures combined will help reduce the spread of COVID-19 and protect the most vulnerable among us. So that's a bit of an overview of contact investigations in Monterey County. I don't know whether we want to ask questions now or Maya, whether you have that time period later in this session.
I'm not sure if Maya's muted or not.
Oh, I'm not muted now.
There we go.
Thank you. Sorry about that. Thank you, Kristi. Stand by for some questions a little bit later. We were to have someone talking about the virtual town hall that's coming up. There's been an incident and they can't attend right now, but we'll have more on that on Monday. So I see that Dr. Moreno is on the line, and I'm hoping he can join us and give us an update and information for today.
Hi, Maya. Good afternoon. Hello, everyone. Really, we've had, I guess what I want to point out today is that we've had a recent, in the last few weeks, recent release of businesses and activities with to resume with some modifications. And we've had some opportunity to look at what the impact of that has been. And we, as Kristi mentioned, we have had an increase in cases. But fortunately, we haven't had a significant increase in the number of people who are hospitalized with COVID-19. We've had a few more deaths, unfortunately, but we are in a pandemic, so we do expect to have increased number of cases. And as we move on, that we will continue to have people from our community who lose their battle with this virus. We have updated provided some updates this week on the format of the webpage where we put our data. And hopefully everyone's been able to look at that. We continue to be able to show at the top of the data page changes in the data from the previous day. What I think the highlights here is that I'll go through quickly. We do have children who have COVID-19. It's a small percentage of the total population with COVID-19, but as a reminder, kids can get infected with it. No one is, unless you've already been infected with it, you're unlikely to have immunity to it. The children are also vulnerable as well. We do have a large percentage of people who test positive from the Hispanic Latino population as they identify themselves. And we do have a lot of those folks coming from Salinas, and the largest percentage of people who test positive are from the Salinas area. So we continue to provide work with partners to do outreach to get as many people as possible out to test sites, the free test sites, preferably for people who have little to no symptoms, so they don't incur a cost of going to the emergency department. And we continue to work with our ag industry and farm worker advocates to get individuals tested and to continue to slow down the spread of disease among countywide, but particularly among our farm working community. We are monitoring how things are going, and we'll continue to monitor using our metrics and indicators how things are going with the release of restrictions moving forward. Let's see what else I'd like to point out, Maya. We continue to work on increasing our, doing what we can to maintain, and if all possible, maintain our capacity in the county to increase a capacity for lab testing for COVID-19. We continue to have the Optum sites available to us. We continue to have high numbers of individuals tested at both Optum sites, and still encourage people to go online or call in to make appointments if you have mild symptoms and don't think you need to be seen by a physician, but you still want to know whether you have COVID-19. That'd be an option for you. And also anyone who's looking to test themselves to see without symptoms to get tested there as well. Anyone who feels sick and is not feeling well, and first recommendation is still call your healthcare provider and get some advice from your healthcare provider. We still have I believe we still have the free health advice from a couple of our hospitals. That's another option. But if you're looking for health advice and health intervention, if you need medical care at this point, we're still encouraging people to seek talk to your healthcare provider, determine if your healthcare provider recommends that you get medical care, and determine with your healthcare provider what's the most appropriate place to receive care. Some healthcare providers are gearing up to see people who have symptoms in their clinics, but the hospitals are still available, and our 4 emergency departments in the county will not refuse to provide service to anyone that shows up seeking health care. And they're still able to collect specimens for testing here in Monterey County. Our test positivity rate in Monterey County still is between 5 and 6%, it's about 5.5% at this time, which is steady here in the county. And we continue to have a large percentage of the tests being performed by the commercial labs, which are LabCorp and Quest, just to give a couple of examples. Our health department is still able to perform tests for our hospitals and healthcare providers who are collecting specimens, and they can send their specimens to our laboratory. We have gotten at times an increased number of specimens in our laboratory, and earlier this week we've tested up to as many as 170 to 190 specimens on a given day. And so we do have the capacity to do a high volume of tests in our laboratory, but we also have a capability to ramp up and exceed our stated maximum number of tests when we are asked to do so by our healthcare providers, and get those test results back to them within typically within 24 hours. So with that, I just want to thank everyone for what we've done in this county, in our community to slow down the spread of COVID-19. This virus is causing a lot of disruption. It's causing a lot of illness. Nationwide, it's caused quite a few deaths, and it's still out there. And from what we can tell, still a majority of people, from what we can tell, still don't have immunity to it. And we still don't have a vaccine. So we need to continue to be mindful of the viruses out there, be respectful of each other, care for one another, make the commitment to protect each other by covering our face when we need to leave our house, be respectful of each other when we try to maintain a 6-foot distance between one another. And if we continue to do these things, which mitigate the impact, we will be able to, should be able to keep up with case investigation and contact tracing to get people into isolation and quarantine, and slowly continue to release more restrictions and allow additional businesses and activities to resume with modifications. So I'll stop there, Maya. Thank you.
Thank you, Dr. Moreno. And we're very fortunate that Kristi Markey from the District 4 office is jumping on the call for us today and is going to tell us a little bit more about the virtual town hall on personal services that is going to happen on June 11th, I believe. Kristi, are you available?
Yes, let me just get this. Sorry, I stepped away from the computer for a minute. Okay, yes, so Supervisors Mary Adams and Jane Parker were assigned to the ad hoc committee on personal care services. And I know the other board ad hoc committees have, I think, somewhat completed their task. Their areas of agriculture and some other businesses have opened, and there are some ad hoc committees that are active, like the hospitality committee that Supervisor Adams is also on. So this committee is just getting started with a public meeting next Thursday, June 11th. So the Personal Care Services Committee will meet on Thursday, June 11th from 5:30 to 7. It'll be a virtual meeting on Zoom. And we're encouraging media to get the word out. We do have a press announcement. I thought it had gone out, but I couldn't get confirmation on that. It will go out if it hasn't gone out already. We will have several key county staff available to speak about where we're at. And of course, you know, with the circumstances changing regularly, next Thursday, who knows where we'll be at in terms of a state. But wherever we're at, the county staff will provide an overview for the participants on that meeting. And we are also sending out a survey link, and we're asking people to fill out the survey. We will have Spanish translation available at our Zoom meeting. And I think the only other detail here is to give a couple of examples of personal care services. We're talking about nail salons, massage, fitness, tattoo parlors, estheticians, I can't even say the word, estheticians, and some other, there's a whole lot of practices out there in mind-body health that are asking where they stand in the reopening process. So anybody who's in the mind-body health category would also be welcome to join this meeting and hopefully get some answers at that time.
Thank you, Kristi. Thanks for jumping in on this, Kristi, very much. And thanks for not making me not feel like the only one who can't pronounce that word. at a moment's notice. And if there are any questions, hold on. There might be some questions about the town hall afterwards. I am going to start with questions. The first question I had was for Kristi Markey on contact tracing. What do you need people to do so you have the right contact information for them? What should they update in particular?
Well, most of the information that we get about our contacts actually comes as part of our case investigation. And we really didn't talk about case investigation, but that's the first piece of the process. So when we have a new case reported to us, the first thing we do is verify the diagnosis. We want to make sure people really have the disease that sometimes they self-report to us. During the process of a case investigation, we ask questions about where the person was, where they might have gotten exposed to the virus, and to whom they might have given it. And that can be people's friends or families. And in those cases, it's usually the case themselves that provides the contact information, the person's name and how to get a hold of them. Sometimes when the person has been at work, we contact the employer, and the employer provides us information about how to get a hold of the people who are in contact with them. So really people, there's not a database that we would go and look up people in per se. We get this information from the people who they have been in contact with.
Right, and then I have another question. This is from a reporter who is driving and is hoping that you might repeat some of the statistics that you had given on contact tracing, such as contact information, how many people you have contacted. I think you gave a series of them.
Sure, so I like to talk about numbers, so sorry for spitting them out really fast. So for every case in Monterey County, we have on average about 8 close contacts. So sometimes our contact investigations can be smaller, sometimes they can be quite larger. We have had contact investigations with over 50 people associated with a single case of COVID-19. Right now in Monterey County, we have 45 trained case and contact investigators. And to date, we've identified over 2,700 contacts, so 2,700 contacts. And we've successfully engaged or been able to contact them or reach them over 98% of those 2,700 contacts. So I think those are the major statistics that I gave.
Great, thank you. And then I have a question for Dr. Moreno. If cases continue to rise, what are the trigger points for going back to a more stringent order or addition, or go back to restrictions that were loosened?
Okay, yeah, thanks. So we have, we have a variety of indicators, 10, I think, to be specific, that we included with the attestation to the state. That was a form that was submitted that attested that Monterey County had met the threshold, or within the thresholds of the 10 indicators for moving forward. And those are available on our county website. A copy of the attestation form is there. We'll be looking at all of those indicators. Those are indicators that are intended to protect the vulnerable population, to have enough surge capacity, to have have enough. Indicators that track the number of cases and deaths in Monterey County, just to name a few of those categories of those indicators. So if and when we have passed those thresholds, we will, which we expect we may be doing, because we are releasing, we and the governor are releasing restrictions and allowing certain business activities to occur, and people are getting out more, and the weather's warming up and people will spend more time outdoors. We'll have to look at whether those thresholds are representative of something that is expected, and we can continue moving forward with our ongoing mitigation and containment efforts, or whether those are early signs that the burden of COVID-19 is concerning and could become excessive, and pose a threat to our use of hospital beds, ICU beds, for example. So fortunately, at this time, we are, again, we have a good amount of hospital bed surge capacity and hospital equipment capacity. We are able to we've been able to, at this time, maintain our capacity for testing here in Monterey County, and we'll continue to work with the vendors and the hospitals and the state to make sure that an ongoing supply of testing material and equipment continue to come into our county. So we'll have to assess all of these as we move forward. And then, as necessary, we will have conversations with the state and our colleagues in other counties to see if this is we're isolated, unique. What's happening is unique to Monterey County, or is this something that's trending statewide? And then make decisions in cooperation with our regional colleagues and with the state health officer. So this is a pandemic, and the pandemic creates new situations, new developments, and what we really need to be able to do is recognize that it's changing all the time, and that we have to be ready, anticipate what might be coming next, and take appropriate actions as this pandemic evolves.
Thank you, Dr. Moreno. I have a question about alternate housing sites, and this may be something Charles can assist me in answering. With the growing number of cases in Latino and Ag in the community, are the alternative housing sites being used, and how many people are being housed in them? I drove by the fairgrounds and it was empty.
Well, not sure how you drive by and see that it's empty, but I appreciate that question. The alternative, larger alternative housing sites, as we talked about on Wednesday, I believe it was, they are still not being utilized at this time specifically for housing because we don't have the need. Those sites are there for backup if we have the need. We do want to support our local businesses as much as possible, and for those hotels, motels that have stepped up to offer the ability to house persons in this situation, we appreciate those offers, and we are working with numerous hotels and motels to provide housing for those persons in need. And the majority of housing right now is centered on the Project Room Key housing, which includes the most vulnerable within the homeless population to having complications if they get COVID-19. And we also have we're working in conjunction with the Growers Shippers Association to provide isolation housing in hotels, motels for agricultural workers who either have COVID-19 or suspected of having COVID-19.
Thanks, Charles. And then for specific numbers for the hotels, that can be found in the daily situation report. And I can forward that report. This question came from Felix. I can forward the report to you if you don't have it. Another question about alternate sites, this one on the alternate care site. Does eliminating the Marina alternate care site impact our variance and attestation?
Ed might want to chime in here, but yeah. The attestation was based on surge capacities at the hospitals, not at an alternative care sites. So it would, whether we have it open or not at this point, I don't believe it would impact the attestation.
Dr. Moreno, would you agree?
Yeah, so thanks, Charles. Yeah, and thanks for the question. As we move forward, there's so many things going on at the same time that questions like this remind me to go back and look at where we were at and where we're at now. So whoever asked the question, I appreciate it. I'm going to go back and look. I believe Charles is right because we didn't actually have the alternative. we didn't actually have the alternative care site up when we put that test station in, so we couldn't count any beds at the proposed alternative care site, only beds that we knew we had at the time that I had tested. But I'll go back and check, but I believe I agree with Charles.
Thank you. And then I'm not sure if anyone knows this off the top, but what is the cost of maintaining the fairgrounds? And that would be the Monterey Fairgrounds and then possibly the Salinas Valley Fairgrounds that was in progress each month.
Well, the Salinas Valley Fairgrounds, we have not moved in any way that would have any costs associated with it. The Monterey Fairgrounds, I'd have to get back to you on the monthly costs on that.
And then the reporter is revising her questions. San Lorenzo Park, it costs, and there may not be too much associated with that since it's a county facility.
Yeah, I think that's right. It is a county facility, and we have the trailers donated. There would be some minimal cost potentially because I believe we have a county employee who has been reassigned from another department to be on-site manager. So there would be that, the cost of the county employee's salary just not being paid by one department. It's now being paid through the, I think through the Emergency Operations Center, if not currently being paid just by their department.
And then a question more specific to housing for farm workers. How many isolation housing sites or sites are being used specifically for farm workers?
I don't know if, I don't have that exact number. I know that the Grower Shippers Association has several hotels, motels that they're working with directly. We have, I don't know if we're up to 10 hotels or motels at the moment. The last I knew we had 8, but I think we may have moved up. And it's not that they're identified for one particular population like agricultural workers or not. We want to make sure that we have appropriate population housing in the hotels, in particular hotels. But at this point, I wouldn't have a specific number to say we have this hotel for farm workers and this hotel for non-farm workers and this hotel for homeless population. So that I know that we have 8 to 10 hotels is my recollection overall right now, and the Grower Shippers has several themselves.
Thank you. And then this is I think you partially answered this question, Charles. Is there an alternative housing site in the Salinas Valley Fairgrounds? And is that addition to San Lorenzo Park? And it is an addition, but the site itself has not yet been established.
Sorry, correct. And yeah, I think that the reasoning there is that, we still have the numbers are still manageable with the resources that we have available. And since the Salinas Valley Fairgrounds is a county property, although we do lease it out to the Fair Board, we have some flexibility there as far as timing and need. And so as we're conferring with the health department on increasing in numbers, if we got to the point where we thought it would be prudent to have that site up and running to be prepared, we would do that.
Thank you. And then Kristi, I have a question for you on contact tracing. Is the county still actively seeking volunteers for tracing?
Thank you so much for asking that question, because I forgot to mention something that I'm really excited about. We have on our county website, if you go to the HR department, you can apply online to volunteer with the health department. There are a variety of areas that we are seeking individuals to help support our public health efforts, either with the call center, with translating and interpreting documents, with case and contact investigations, and looking down the road for the time when we might have a vaccine, people who might want to help us to support mass immunization clinics in our communities. So if you go to the county's website, I believe it's www.co.monterey.ca.us. Under departments for HR, go under job seekers and put in health department volunteer is the name of the position, and you can apply online. Your name will be put into a database. There's just a few basic questions to ask, and then when we have positions open, we can pull from that list and utilize the great volunteers from our communities.
Thank you, Kristi. And then this question for Dr. Moreno: what kind of outreach or education continues to be done for Latino and Ag communities to prevent the spread of the virus in those groups?
Hi, thank you, Mia. I usually allow Charles to answer this question. He's been very involved with those organizations and their representatives. Do you mind answering it again, Charles?
If I knew the question, because I was multitasking, sorry.
What kind of outreach or education continues to be done for specifically the Latino or Ag community to prevent the spread of the virus?
Great question. I know that, and I'm going to miss some on the answer. I know there have been efforts with the hospitals to get into the Latino community and the Ag community, specifically to make sure that they get the message from healthcare professionals about reducing the spread. I also know that the different trade organizations such as Grower Shippers Association, the Farm Bureau, and the Vintners and Growers Association has also been pushing out. They've been pushing out messages through their members. Excuse me, and I believe that the Agricultural Commissioner is preparing cards similar to what they prepare for pesticide cautions, cards for the farm workers to have, which will have some of that information in a short, kind of easy to digest format that they can quickly look at and maybe get some information. And I'm not sure if they'll have contact info, but my understanding is that the Ag Committee, I don't know if he's finished those cards, but it's something that he's working on.
Thank you, Charles. I have no other questions on chat. Are there any questions from the group? Seeing none, hearing none, that will wrap up our media briefing for today. Thanks everyone for joining us, and have a nice weekend.